Welcome to the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Welcome to another episode of the Chad G. Ortho OT Podcast. I'm your host, Chad Guerrero, and today I'm going to share with you guys a really interesting case that I had a few years ago, and man, it was really amazing to me that how many people miss this, and there's parts of it that still are a little bit of a mystery to me, but overall, I'll tell you what I did and kind of how we treated it and the thought process I went into, trying to figure this out. So I had a teenage softball player that come in, and she previously had two surgeries. One, she had an ulnar nerve relocation, and where they took the nerve from the bottom side of the epicondyle and moved it up out of the cubital tunnel, the top of the elbow, and then the other that she had was carpal tunnel release. Now, at the time, if I'm not mistaken, she was 14 or 15, I think. And I don't know of any 15-year-olds that's had both carpal tunnel and this ulnar nerve relocation done. Actually, this was the first one that I'd ever had that had both at the same time. And so anyway, she went to therapy at the physician's clinic, and was still having a lot of pain, a lot of limitations with range of motion, a lot of numbness, paresthesia, a whole host of stuff going on. And so I got her, and the first day that I evaluated her, when I first seen her, she's sitting on the mat, and I'm looking at her straight on. And this surgical procedure is on the right side. And so I'm looking at her straight on, and the first thing that I notice is her head is tilted, so her right ear is coming over towards her shoulder a little bit. She's in right lateral flexion, and I measured it. She's resting at about 15 degrees. And I just asked her, I said, do you feel like that you're sitting straight? And she's like, yeah, I feel like I'm straight, And I said, well, your head is tilted to the side. I actually took a picture of it so I could show her. And she was actually amazed. Like, I didn't know that my head was tilted to the side. And so I go through, I measure all the cervical ranges of motion and strength, and I do all this, and thoracic, spine, lumbar, and then I go into my, upper quarter, test everything from range of motion, muscle strength, grip strength, reflexes, sensory testing, neurodynamics testing the three nerves that are going into the arm and the hand, two of which she had surgically messed with, and just a lot of stuff going on. And, and basically at this point, she's just released to just do whatever, any kind of exercises, whatever can happen, we need to do. And just a huge range of motion and strength deficit that we seen, myself and then my staff. I had them come in. I'm like, y'all, look at this. This is kind of crazy. And what was really amazing to me, other than the fact that she was as young as she was and having these procedures. Now, I'm not saying these were not warranted procedures, so that's a physician's call, not mine. But like I said, the other thing that I noticed was the lateral flexion of her head towards the side she had surgery on. And so I said, I'm going to do some little thoracic outlet testing, right? So if you're not familiar with what thoracic outlet is, it's compression of the brachial plexus, the nerves that go into the arm and the hand on each side. They come out the side of the neck and what's known as the thoracic outlet. And they can become impinged either neurogenically, the nerves, or vascularly. The subclavian artery and vein is also there. And usually for 4 different reasons. One is the anterior scalene muscle in the neck is tight, which hers was very tight, and that's what had her kind of pulled over to the side like that. The other can be from an elevated first rib, which again, the anterior scalene attaches to the ribs, so I can pull that up. And then pec minor being tight, and also a first rib I say first rib, an extra rib. So you can actually have an extra rib. Of T1 is where the first rib happens, and so at C7 you can actually have a small rib that comes off of that, and that can rub and compress the nerves. And you usually can see that, especially if it's a slender person, you can see that through the skin. And a lot of times the surgeon goes in and will remove that, just take that out. It's just a congenital deformity. It's been there since you were born, just progressively, growing over the years, So some people it bothers them, and some people it never bothers them at all, and it's fine. So anyway, so I started doing, a little bit of this thoracic outlet testing, and she was positive. She was positive both for neurogenic and for vascular. The radial pulse went away. When I tried to take the pulse on that side, completely went away when I went through the testing for that. And then during some of the tests, the Addison sign or Addison's test was positive for anterior scalene impingement of the brachial plexus. And so, so all these tests that I'm doing just provocatively, in clinic are all causing pain. And so we treated her not just like she had the surgeries on her, her forearm and wrist, but then also like it's a thoracic outlet case. So we did, upper body things addressing the thoracic outlet, which worked really, really well because she said she'd not had that done before, and the therapists are just focusing on just rotator cuff kind of strengthening or elbow strengthening or whatever, and not addressing this presumed thoracic outlet issue. And so we started doing that and immediately started gaining, range of motion and improvements with her pain, pain tolerance, range of motion, neural tension, how much tension, the nerves were experiencing, all that started to improve. And her resting head position improved as well. Went to just, a normal resting head position. And then I did parts of like the SFMA, at that time I had not really taken the SFMA courses per se, but I had courses that some of the instructors were SFMA certified. And so, they just also kind of threw in some of those techniques. And so I screened some of that stuff as well. And everything was progressing really, really well. Range of motion was doing great. Matter of fact, she started back swinging a bat. She played not just school ball, but also travel softball as well. And so everything started coming back really well. And then all of a sudden, for some really crazy reason, we started having these tremors that started in her arm and hand. And the entire arm and hand would tremor. And sometimes it lasted for hours, and sometimes it was pretty quick to resolve. I think the fastest that we got it resolved was like 2 minutes or something like that. And the way that I did that, and the way that I kind of fast forward, I continue to do it periodically when she has a flare-up, is I use like a blood flow restriction band or piece of TheraBand or something like that, and I do some put it around the arm, almost like a tourniquet, and that seems to have an effect. We straighten out her elbow and her wrists, just in a neutral position, tighten that up and kind of bind it down a little bit, and we get a good response. And I think that has to do something with, I'm not really sure. That's kind of the part I'm going to get to, is the confusing part. But anyway, so we did this, and then the next thing you know, it starts to turn in periodically to almost like a facial tic as well. So she has like this tic on the side of the face with her lip and her eye and the cheek muscle, and all this starts to happen, which is, kind of what's going on here. And so she ends up seeing a couple of different specialists, actually seeing a thoracic outlet specialist, and had all this imaging done, and they said there was nothing compressing the thoracic outlet. So there's nothing touching any of that. Which, by the point that they did that, this was much later than her original evaluation. So, I don't know if still we had reduced that and taken that pressure off, and this is still something residual, or what the deal kind of was. But so she still had that off and on periodically, and then she went over the course of several years not having very many episodes. A lot of it was, kind of went away, just an occasional flare up. Again, really not sure why this occasional flare-up is happening. And even still, she periodically may have a flare-up, and it may be once a month, it may be once every couple of months, that she has, we call it a flare-up, or a repeat episode where you have this tremor going on. So in the right upper extremity, or the right extremity rather, the entire right extremity, with an occasional face spasming and kind of a tick as well. So I just thought that that was a very interesting case with no real, I don't have like an end closure to it, honestly. I do know that initially the thoracic outlet treatment that we did worked, so that leads me to believe that it very much initially was a thoracic outlet issue. And I don't know if that was because of just tampering with the nerves and, the distal nerves that kind of triggered something or what. But we did make, really good improvements from there. And she did regain all her range of motion. So that is one thing. She regained all the range of motion, and the strength in the right arm and hand, which she previously did not have. And that was just with conventional, we're just going to do the 3 sets of 10 exercises or whatever she had said she was doing, at a previous location. So anyway, I just thought that was super interesting. And I guess the takeaway from this is, as a clinician, make sure that you're looking at everything. If maybe you consider yourself, let's just say in this case, a hand therapist, and you work elbow to hand or shoulder to hand or whatever that is, make sure you're evaluating cervical spine, thoracic spine. Look at everything. There's contributions from a lot of different parts of the body that affect the arm or vice versa. I mean, when we walk, it's around 50% of propulsion happens from swinging our arms. And if you think it doesn't, try to, run with your arms crossed and see how that works out. It's not very good. So I think as a clinician, the big takeaway, and I've told this to students since then that I've had, make sure that you look at everything, because in this person's case, I think we did, I would say we did 90% of what I wanted to accomplish, and there's a 10% that I'm still confused to this day as to what caused the ongoing tremoring that happened, and not just in the arm, that also went into the neck and face. So if anybody has any ideas on that, I'd be interested to hear what you had to say. Shoot me an email at you can send it to chadgorthoot@gmail.com, and I would love to hear any responses on that. Or I'm on TikTok, Instagram, Facebook, LinkedIn, Twitter. You can find me on all those locations. So if you have some input on that, or you have a question on that, for sure send it to me, because I'm interested. So anyway, so that's it for today, guys. I just want to share that one with you. The odd thoracic outlet case, I presume that's what it was. That's what we treated, and that's what got us the best results. So thanks so much for listening. Please rate this podcast 5 stars wherever you listen. That definitely helps me out. And then please subscribe if you would, and continue putting out some information. And you guys have an awesome day. Thanks for listening. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.